If you would bear with me for just a minute, I want to share with you another issue that I think is plaguing the United States that we need to have some good quality legislative discussion, and that is the opioid crisis that has plagued and is plaguing this country. I remember recently doing some research on the topic because I mentioned how liberal our trade policies were along the southern border and how we used the transportation arteries south of the Rio Grande, okay, to introduce narcotics into the veins of a very addicted United States of America. One example I want to bring up is one that I researched about a problem going on in Indiana, and I believe that in a measure these things are taking place in the contiguous 48 states. And to introduce ideas and encourage comments from you on best ways that we can collectively come up with a solution to the problem. In Indiana, as one of the states, again, a microcosm of the entire country, we have parents who died, killing themselves as a result of narcotics abuses. And in one example that I saw, the parents were dead in the front seat of the car and their children were strapped in the children's modified seats in the back. If you multiply that out exponentially, we are beginning to flood our child care facilities. We are looking at persons who have been made orphans suddenly and inundating the system with persons who have lost their primary caregivers to the opioid and narcotics crisis in the country. For those who we are able to rescue for the moment, we put them into treatment facilities, but their recidivism rate is somewhere between 70 and 75%. And we have not properly addressed this. I believe that the president has finally come through and said that we are treating these narcotics abuses as a health crisis. And I certainly don't dispute that. I want to say that the reputation that we have for incarceration in the country speaks to the wrong things we're doing trying to address that problem. And I don't think we're going to incarcerate the problem away. We have seen where our penal system is failing to take care of the social ills that people believe it's designed to take care of. Again, with our recidivism rates being what they are, in the penal system, we are seeing those things replicated with the opioid crisis because people are unable to shake that monkey off of their back. I use that metaphorically speaking. That recidivism rate is something we got to get after, and we have got to come up with methods to arrest this problem so we don't continue the recidivism rates and increasing the rate of orphans that are being placed in foster care and what byproducts grow from that. From my studies with the situation in Indiana, one particular judge had made a comment. I'm trying to think of where in Indiana it was taking place, but in having to adjudicate these particular cases, we are seeing a jump from 2,500 last year to 5,500 this year. Children who are being left to fend for themselves, who are being relegated to the foster care system, and they're coming in so fast that we're finding where they have grandparents who can step in. The grandparents are stepping in, but it's becoming an epidemic socially because we don't have the adult population assets and resources. There's not enough family to take care of these people who are victims of the abuses that their parents are committing. We have got to get a handle on what is creating such a vast appetite for narcotics and substance abuse in the country, where people are looking at ways to mitigate their miseries through something illegal rather than something legal. And again, given the assets and resources that the United States has, I think we need to adopt legislation to take advantage of the president's current disposition to treat this as a healthcare crisis, and again, devote the assets and resources to take care of that. I want to string that to, or tether that to, the recommendation that I made about looking at some of these people we're talking about deporting and offer them opportunities to take care of these circumstances by having them look at their own skill sets and competencies and possibly steer them into some of the career shortages that we're facing around the community and around the country, train them up so that we are building our own bench within the confines of the United States and possibly having to reduce the H-1B visa importing talent that our public education systems are not producing right now. We need to have all hands on deck to get after this opioid crisis, and I'm not sitting here to tell you that I have all of the solutions to it, but I know that we're not going to incarcerate our way out of this situation, that we need to have our medical professionals right now look at alternate means and not be so quick to introduce a pain-killing method that might wind up having our people addicted to something that is initially designed to try to mitigate their misery, take care of them, and restore them back to good health. Jerome Tillman, again, 16th Congressional District candidate, 850-VOTE. Would love to hear from you. Get your input on this situation as well.